For so many of us over 65, taking our blood pressure can feel less like a simple health check and more like, well, a high-stakes test we have to pass every morning. But what if we could flip that feeling? What if we could go from anxiety to feeling empowered? Well, that's what we're going to do today. We are going to completely transform how you see those numbers and give you the tools to take control.
Does that sound familiar? You wrap that cuff around your arm, you hit the button, and you just hold your breath, waiting for the verdict. That daily stress, that worry that the numbers might be up, ironically, that can make them go even higher. It's this frustrating cycle, right? But we are absolutely going to break it today.
All right, let's start with a big idea. The numbers on that machine, they're not a grade. It's not judging you. Think of it more like a weather report for your arteries. It's just a piece of data, a little snapshot in time. It's there to tell you if things are looking clear and sunny, or if maybe you need to grab an umbrella. It's information, not an accusation. Now, to understand that weather report, you need the legend, right? You need to know what the symbols mean. So here are the official categories from Intermountain Health. Normal is what you're aiming for, less than 120/80. As those numbers climb, you move into elevated, and then into stage 1 and stage 2 high blood pressure. Knowing where your numbers fall, that's the first step, but believe me, it is just the beginning of the story, not the final chapter.
So, where do we begin? We start by getting good, honest data. Because think about it, if you're checking your pressure at all different times of the day, like right after a brisk walk or a stressful phone call, you're not getting a true picture. You're getting a reading that's been affected by, well, life. We need a baseline. And this brings us to what is maybe the most important rule of all. Check your blood pressure at the same time every morning, and this is the key, before you have that first cup of coffee. Why? Because caffeine is a vasoconstrictor. That's a fancy word, but all it means is it temporarily shrinks your blood vessels. That can artificially spike your reading by 10 points or even more. So, new rule, monitor first, coffee second.
And to get that really honest number for your doctor, just follow this simple little 3-step routine. First, empty your bladder. A full bladder can actually nudge your reading up a bit. Second, sit down in a supportive chair and just be quiet for 5 full minutes. No scrolling on your phone, no watching the morning news, just 5 minutes of calm. And third, make sure your arm is supported right at heart level. This simple routine gives you what's called your resting state, and that is the most accurate picture of what's really going on.
Okay, now that we know how to get an accurate number, let's talk about the fun part, how to influence those numbers for the better. And listen, this is not about restrictive diets or grueling workouts. I want you to think of these as your personal, proactive toolkit, things you can use every single day to take back control. One of the most powerful tools in that kit is something called the DASH diet. And it's not complicated at all. It's really just about focusing on real, whole foods. Fruits, veggies, whole grains, lean proteins, the good stuff. In fact, studies have shown that a healthy eating plan like this can lower your top blood pressure number by an average of 11 points. I mean, that is a huge impact from something completely within your control. Now let's talk about 2 minerals that have a kind of push-pull relationship. We are always told to cut back on sodium, right? Because it narrows our blood vessels. But here's the secret weapon: potassium. Potassium actually helps your kidneys flush out extra sodium, and it helps ease the tension in your blood vessel walls. So a lot of times it's actually easier to focus on adding potassium-rich foods like sweet potatoes or bananas than it is to obsess over every grain of salt.
And you absolutely do not need to join a gym to make a difference. These are simple 5-minute fixes from Jackson Health System that you can do anywhere. Things like deep breathing that can literally trigger your body's relaxation response. Isometric hand grips are great for blood vessel flexibility. And gentle movements like wall push-ups or neck rolls that get the circulation going. Just 5 minutes a day can make a real noticeable difference.
We've talked a lot about managing high blood pressure, but now I want to pivot to a really critical safety tip. We need to talk about the other side of the coin, blood pressure that drops too low, too fast. This is a hidden danger that honestly causes thousands of preventable falls every single year. The official name for it is orthostatic hypotension. But you already know what it feels like. Have you ever stood up quickly and, whoa, the room just spins for a second? That's it. What's happening is that as we get older, our body's internal sensors that regulate blood pressure when we change positions, well, they can get a little bit slower. So when you stand up, for a brief moment, not enough blood gets to your brain, and you get that dizzy, unstable feeling. And the real danger here isn't just the dizziness. It's the fall that can happen because of it. A fall can lead to a serious injury like a hip fracture. But the fix?
Oh, the fix is so incredibly simple. It's the 3-step stand. Before you get up, step 1, just sit on the edge of the bed or chair. Step 2, pause and let your feet dangle for about 30 seconds. This gives your body a chance to adjust. And finally, step 3, stand up slowly, holding on to something stable. That's it. It's a simple habit that can literally be a lifesaver.
So, this brings us to a more nuanced part of the conversation. For decades, we've been taught that when it comes to blood pressure, lower is always better. But especially for older adults, it turns out the answer is a little more complicated. This is about you becoming an informed, active partner in your own healthcare.
And this is a really critical point to understand. Research is showing that for some older or more frail adults, being too aggressive with blood pressure medication, pushing it too low, can actually introduce new risks. It can sometimes affect kidney function, cognitive performance, and, you guessed it, significantly increase the risk of those dangerous falls we just talked about.
So what this really means is that a goal of 120/80, which might be perfect for a healthy 60-year-old, could actually be too aggressive for an 85-year-old with other health challenges. So the single most important question you can bring to your doctor is this one right here. Is my blood pressure goal right for me? That question opens up a personalized conversation about what's truly safe and effective for your unique situation.
You see, this all comes back to where we started. Mastering your blood pressure isn't about being afraid of a number on a little machine. It's about taking smart, proactive steps to protect your quality of life. It's about making sure you can live safely, actively, and independently for as long as you possibly can.
So, we've covered a lot. We've talked about reframing those numbers, how to get honest data, and how to use proactive tools to stay in control. I'll leave you with this final thought. With everything you now know, what's the one question that you'll ask your doctor at your next visit that could make all the difference for you?